Everyone. Thank you for joining us for our second session in our Early Childhood Education and Care conversation series. Before we begin, I'd like to acknowledge the traditional custodians of the lands from which we're all joining from today. We pay our respects to elders past and present and extend that respect to any Aboriginal and Torres Strait Islander people joining us today. We acknowledge their continuing connection to land, waters and community. My name is Bree and I'm joining today from the lands of the Murrumarang people on Yuin Nation. I do encourage you to share which lands you're joining from in the chat. Excuse me, I do have a little bit of a horsey voice today. But just a quick note before we do begin, we're hoping this session will run for approximately 30 minutes. Please note this session is being recorded and all registered participants will receive a link to the recording. To ensure a smooth experience for everyone, for technical support, please use the chat function. For questions about the content, please use the Q&A box. We will try and answer these questions if time permits. Otherwise, we'll ensure the questions are addressed and provided with a video recording afterwards. A few little notes on privacy. As I mentioned, this session is being recorded for future viewing, so please be mindful of this when asking your questions or engaging in the chat. If you could please refrain from taking screenshots or making your own recordings without permission also. But as I said, this session is part of a 4-part conversation series on navigating early childhood education and care for children with disability, developmental delay and autism. This series is brought to you by Belongside Families. That might be a new name to some of you. We were formerly Kindred, and that is our new name, which I love. But we are bringing this to you in partnership with the Early Childhood Intervention Best Practice Network. And today's session is going to focus on what best practice therapy looks like in early childhood education and care. And we are fortunate to be joined by 2 wonderful speakers who are going to share their expertise and experiences. We do have Vilike. Did I get it right?
Yes, well done.
A bit hard with my horsey voice too, so I apologize if I do get that wrong throughout the session. But Vilike is an experienced early childhood educator and preschool intervention practice lead with Karana Preschools. And we have Eliza as well. Eliza is a parent of 3 neurodivergent boys, including Solomon, who will share her family's journey with therapy in an early childhood education and care setting. Excuse me. Before we do get started, I do want to acknowledge, as always, that everyone's journey is unique, and we encourage you to take what resonates with your situation and discuss it with your child support network. This might include their educators, it could be the therapy team and medical professionals. The best outcomes often come from a collaborative approach where families work together with their child's team to adapt strategies to suit their specific circumstances. So before I lose my voice, I'm going to go straight to you, Vilike. But can you help us understand what best practice therapy looks like in a typical day at preschool? So what might parents expect to see happening?
Yeah, absolutely. So therapy at preschool looks really different than therapy like in a clinical setting. So we really try to follow the preschool's routine, like the daily activities that are provided, and follow the child's interests. And we work alongside them. So we don't take the children out for a therapy session. We don't take them outside of the classroom, but we bring therapy into the classroom and bring our strategies into the room and just adapt them, like just use them throughout the day, what the children are doing. If it's a mealtime or a social skill activity, we just focus on what the children are doing and join in there instead of taking the child out to come and join us.
Amazing. Eliza, were there any particular therapy strategies that you saw make a real difference for Solomon's social connections? Oh, sorry, I'm jumping ahead of myself. Thinking back to Solomon's time in daycare, what did meaningful therapy support actually look like in practice for you guys?
That's okay. Yeah, it was exactly what Vilike is saying. It was about being in situ. It was about responding sort of on the spot. You know, those professionals being able to observe him, see what his needs were, see what he was having challenges with, and equip him there and then. And I think that was really, really good. They were able to see why he was doing what he was doing and not just take it at face value. They were able to observe, you know, how he was managing the different things. So whether it was just him at play or him joining at floor time, that was a bit of a challenge for him. Being at the lunch table, outings, even if they were, you know, like a little excursion, there were times that they were able to go along for that. So they had this really good real world view of what was going on for him and being able to equip him for that. And I think that that's just, it's more authentic, you know, it's not prescriptive. If you're in a, and I loved clinic sessions as well for other reasons, but in a clinic, I think it's sort of more like following a program, here's the goal. Whereas in practice, it was just so, it had to be adaptable. They had to respond and see, here's the issue. How can we support him to manage this better? And I think also having the OT, the speechy, the key worker, they were sort of bridging the gaps with each other. You know, they all have their different areas of expertise and it comes together so well, and equipped him really broadly. It gave him sort of like, yes, I guess some social scripts and so on, but things like he just had more of a toolbox. He was able to go, okay, it's okay to say, no, I'm not ready to hand that toy back. Or, you know, I'm going to ask this child to play, but he also had a support person there to say, they might say no, maybe later. And that's okay. We can ask someone else. So they were just supporting. I mean, the word is support, but they were supporting him for all his interactions. And the fact that there wasn't that withdrawal, it wasn't like, okay, we're going to go off into a little room and do therapy with just Sol. There's no singling out. That was really beautiful and really meaningful, I think.
Yeah, and you've both actually touched on that around not taking the child away from the activities. But Billy, I wanted to come to you now, and Eliza's probably touched on it a little bit there, but how do you approach weaving those therapy strategies into those natural play and daily routines in those childcare settings?
Yeah, so like what Eliza said, like it's about the real life setting. Like you can't focus on social skills in a clinic room where it's just you. Like you can't focus on that without another child. And preschool is so good for that because there's heaps of children around and each child has their social preferences, their sensory preferences, and seeing how they respond in those situations and then provide the support that's needed at that time is just so valuable because you can't fabricate that. You can't bring that into a clinic room where it's just you and the child. So it's for us at preschool, it's really important to observe the children and letting them try to figure it out. And you're there, like you're alongside them. You're not doing it for them. You're not telling them what to do. You're letting them try. And if they need you, you're there. You can model it to them. And it's a learning opportunity for them without realizing that they're learning, if that makes sense.
It does.
Yeah.
Absolutely. Eliza, were there any actual particular strategies that you saw make a real difference for Solomon's social connections with the other children?
Yes, there were times that his therapist, his allied health supporters were kind of working as a translator, and there were times that his educators might not have seen what was going on. Other children certainly wouldn't have seen what was going on. Even me, as his mother, I would have thought Sol's just being a bit of a pain in the bum today, you know. but that professional insight to be able to go, okay, yes, he's stealing the other kid's hat, right? That's a play bit. To be able to go, no, he's not trying to annoy. That's him trying to make an invitation to play. So let's upskill him. Let's give him some options, that sort of thing. So giving him the social tools and seeing what he wanted to do. Also following his interests, being able to notice something that he was doing. Oh gosh, like smashing a train into a wall and going, all right, well, what he's actually doing here is he's wanting to experiment with pressure and sound. And let's set up a science table. And we had just really great therapists who would be able to have a word with the educators and say, let's follow this line of thinking. Let's do this with Sol, involve the other kids. It was just fantastic having that professional insight, and have him equipped with things like just coping with transitions, which is when he wouldn't join in. He wouldn't join in with his peers because the whole transitional process was so hard. But they had the strategies to bring into the classroom so that he was then able to join in with his peers a bit more. So I think that really supported him socially as well.
I really like that example that you gave about the truck going into the wall and actually flipping that around to go, what is he trying to achieve here? Like, and I love it. That's such a great example. Um, Billy, how do you balance supporting a child's individual needs while maintaining the flow of group activities? Because there is so much, so many group activities when you're in those kind of settings. It's not quite individual activities. Yeah, how do you go
Yeah.
with that?
Yeah, like you said, like a preschool can be a lot. Like any early childhood education setting can be a lot, as for an adult, but also for children. And like one of the moments that we find particularly that come up during the day that can be quite stressful and challenging for children are the meal times. Because we have this idea that children, they all need to sit down together. It's now morning tea time. Let's bring everybody to the table and we're all going to sit and have our meal and nobody leave. And that's not what works for everybody. So we have actually changed our model around that, and we are now offering progressive morning teas. So that means that the children can listen to the cues in their body. They can learn to understand they're hungry or they're thirsty. They can come and get their lunchbox by themselves. They can eat how much they want, when they want, what they want, and they can go again. And if 5 minutes later they want to come back, that's absolutely fine. I should note, like, as long everything happens in a safe manner and people are not like jumping around with food in their mouth. But it's so important that children have a say about when they eat, what they eat, how much they eat, because that's what we do as adults as well. So why shouldn't children be allowed to do that? And with like sitting down for meal times, it's also looking at, does the child want to sit on a chair or do they want to sit on the floor? Do they need to have like a wobble cushion to get the sensory inputs that they need? Or are they okay to just sit down without anything else? Do they need a fidget toy with them to extend their period at the table? Just looking at what each individual child needs is so important, and being able to offer that as well, I think, yeah, it's really, really valuable.
Yeah, I love that example of the progressive lunch. I just, my son's in year 5 now, so it's been a long time since we've been in those settings. And I don't think that was something when he was in his early childcare setting. But we do speak to so many families that, eating is a really big challenge for their children when they go to school. It comes up quite a lot in all of our My Time sessions. So I like that, there is that adaptation and, working with what works best for that child. I really like that example. I've heard it a couple of times now through these sessions, and I think it's great. I'm just wondering if you could, and I know, Eliza, you've already shared a few of these, and I'm excited to hear some more, but could you share some examples of how educators and therapists work together to turn everyday moments into learning opportunities?
You want to go first, Billy, or shall I?
You can go.
I'll go. So everyday learning opportunities. Okay, here's a big example. Solomon could not cope with rest time. That is, he's not much of a rester. And the therapists and the educators sort of work together about, well, what's going to be restful for him, but that's still going to be enriching for him, occupying for him, and direct him positively. So that became his personal craft time. It was a bit of one-on-one with an educator. It was a quiet activity, and it was productive, and he wasn't then disrupting anyone else's rest. And so I would say that's probably a big one, because it became a regular part of his day. But I mean, they stepped in for all kinds of things as well to make those everyday moments and everyday routines and everything just go so much more smoothly. So the key worker in particular would come in and take photos of things to prepare him for, like, here's a visual routine, or here's what we're going to do, or here's a visual timetable, and would give the educators tasks as well to say, well, how about we do this? How about, what if you made that? Would this work for you? Yeah, so that was quite collaborative as well.
Well, I love that. Collaboration is so important. Philike, do you have any examples of how educators and therapists work together to turn some of those everyday moments into learning opportunities?
Yeah, absolutely. Like Liza said, like it all happens like during the day, and it happens so quickly. So like having a visual schedule or just visuals to communicate, like support the communication are such a simple way to even promote like further learning. But like we have some children who, for example, are still wearing nappies, and just commenting on what is happening. Like you are now stepping onto the changing table and helping the child get on the table like by themselves, like supporting them, like you're working on like gross motor skills. You're modeling the language with what you're doing. I'm taking your pants off, I'm taking your nappy off, I'm going to wipe you. Just explaining and telling them what is happening. The exposure to language, even if it's a non-speaking child, the exposure to language is so important. And also for them to have an understanding what is actually going to happen. Because not just with nappy changing routines, but also just like wiping somebody's nose or putting a hat on somebody's head. Like if you don't tell them what is going to happen, why would they be okay with that? Like imagine if somebody just came up to you and just wiped your face.
It gives more bodily autonomy too, doesn't it?
Yeah.
It gives that sense that kids can understand what's going on and they have choices. And I think that happened a lot with Sol as well. I know you're talking about physical things, but with kind of behavioral and emotional regulatory things, I noticed that there became a lot more discourse around, I notice you seem to be feeling, I wonder why that, you know, so yeah, I think it's that same, the language.
Yeah, absolutely. Just label everything, model everything, explain it. It's so important. And often that gets missed because not everybody might think that the children understand what is happening, especially when they are non-speaking. But it's still so valuable and so important, like what you said, for the sense of bodily autonomy. Yeah, so just applying this throughout the day with every routine that you are doing. And like you said, other activities where you like you see what they need, like if they need at rest time, if they need something in particular, like a craft activity or arts and crafts. But also during a group time, when you know, okay, this child's listening skills look different to what another child might like demonstrate. So if you can offer them a fidget toy, or if you can let them walk around during group time, or if you, again, give them a wobble cushion or a special chair to sit on, they might be able to listen a bit more and a bit longer. And I should also say, like, it doesn't mean that they're not listening if they're walking around, because they still might be registering everything that is being said during a group time. So just knowing that what we have been taught, like what listening should look like, is not necessarily what it looks like. And that applies to everything, really. Yeah.
Yeah, and I imagine
kids having those options. Oh, sorry.
I was just going to say, you go, Eliza.
Just kids having those options and it being sort of normalized. The other kids seeing that too. That's inclusion, isn't it? You know, seeing a child among them having disability support, seeing a child among them having options or doing things differently. I think that relates back to your questions about everyday moments. It relates back to your question about social relationships, because, you know, that's when the other kids around them are seeing that they have options, that this child has options, that everyone needs different things. I just think that can only be positive.
Yeah. And I was just going to say, I imagine as well, like when you're talking them through every step of the way, only benefits everyone around them as well. Do you know what I mean? Like, you know, we're talking about young kids that, you know, might need those extra prompts and instructions. And then when they're hearing them be said to other children in the area, like they're only going to benefit from it as well.
Yeah.
Well, it works all around. I want to talk now a little bit about communication, and we have got a question in the chat, which I'll come to in a moment, but what have you found makes for successful communication between families, therapists, and early childcare settings? And either of you, I'd love to hear from both of you, because obviously you've got the parent perspective, Eliza, and Vilike, you're coming from that childcare setting, but what makes for successful communication? Who's going to go first? I'll go to you, Vilike.
I'll go first. Honesty, being honest and really working with the family, being on the same team, and really having that clear is really important. Because it's not us against the families, like it's us with the family, and we want the same. So honesty and open communication about everything. Like it doesn't matter at what point you are in your journey, I guess, with a child who has a disability or has just been diagnosed. Like, we are there for you, and we want to help you, but we need to be honest with each other about what that's going to look like. Yeah, I think honesty is just very important in the communication.
Yeah, absolutely. What about you, Eliza?
I could probably say a lot about communication. There's obviously different ways which will suit you at different times. So to have emails or to have a phone call or just, a quick chat, and that's about what works for you and about your capacity as well. And I'm really mindful of the fact that we as parents, it can really drain on us, especially when sometimes the communication isn't exactly what you're hoping to hear. It can be good to say, okay, like, maybe don't drip feed me. Maybe let's wait till the end of the week and have, like, hit me with it then, and we'll work out what next from there. I found that it was really good sometimes to have my professional team sort of be an in-between person, and that was really good for me capacity wise. But yeah, no, you're right, there is no enemy, no one is the enemy, and you are all working together. And I think that's another really good element of it too, is that you have multiple pairs of eyes with all these different strengths that they bring to supporting your child, the educators, the allied health, you yourself, and it just gives that broader blanket view of what is going on, and you can sort of support each other and give different insights about, he was doing this, that might be to do with that. And I think that's really thorough and helpful. I also found that it was great to have people upskilling each other. So we actually had our OT do a session for the staff, so give them some professional development as well, just to talk about preferred language, to talk about some more contemporary understandings of neurodivergence. And it was beautiful. It just elevated the discourse, and I thought that was really, really great. I thought it was really helpful to everyone, beneficial to everyone. And yeah, you just get all these different insights, and you can weigh up what's best for your child. We didn't always stick with the same allied health therapist. There were times we went, okay, I've seen this, you've seen this, and he said this, and you know what, maybe this is just not a good fit. So I think, yeah, good broad communication is really, really helpful. And another thing that kind of lifts a bit of the burden for you as the parent is that there may be slightly less taxing communication, as in you might not have to advocate so hard for your child. When you have an allied health person going in, seeing the needs, getting the needs met with strategies right away, it's not like you're then going to be coming home with an unhappy child more often because they're not being, maybe they're not being understood or not being supported correctly. When the allied health professional is going in there and just going, I see this, let's try that.
Yeah.
Then you're sort of avoiding the battles before they would have to happen,
Yeah. Agree. I'll just might go to the question in the chat, because I might go to you about this, Villa. So it's a parent that's just saying they're having a bit of an issue with collaboration, and it's more around the cost. So obviously they're using their NDIS funds at the moment for the OT and the physio to go into preschool. And just knowing that there's going to be this ongoing cost, is there any kind of additional supports that preschools or childcare settings can apply for to help cover the cost of those sessions? Like, is there anything outside of NDIS that, the centre themselves can use to get some upskilling or anything like that you're aware of?
There's definitely, like, the centre can apply for inclusion support. And this, like, inclusion supports can look differently for what, like, the centre needs. So they can have additional resources. They can have an extra teacher on site to help in the classroom. When I say there can be an extra teacher or educator, that's not to be one-on-one with the child, but it's supposed to create opportunity for the other educators to spend more time making sure that that child can participate in the program. So if you have your OT or your physio coming into the preschool, they can upskill the other educators, so that you're not just spending your money for that 1 hour session, but that you're actually teaching the people who are there for much longer than 1 hour per day, who can actually then implement those sessions. So that makes your funding go further, I guess. But like Eliza said before as well, it's so important to upskill the people around your child, because not everybody has the same knowledge, the same experience. So it's really important to share that. And if your OT or your physio or your speechy or whoever it might be, if they just come in and go without having that communication and collaboration with the team, then I'm not sure that they're doing what they can be doing.
Yeah.
Yeah.
I've put the link in the chat and I'll share it in the resource email to the inclusion support program, the one that's within New South Wales.
Yeah.
But thank you for answering that question. But we are coming towards the end of this session, and Eliza, I'm going to go to you first. But looking back on Solomon's journey, what advice would you give to parents who are just starting to explore therapy supports in their early childcare education setting?
I just think I think it's an investment that's worth every penny. You handed this budget, and personally, I felt like it was my duty to just, stretch it as far as it could possibly go. So the idea of having to pay for travel, I thought, oh, no, if we go to the clinic, then we maximum time. I just don't see it like that anymore. I just see it as really good bang for your buck, because in situ just is so effective and so responsive. I just wouldn't be without it now. In clinic practice can be great. I just think that it's so wonderful for them to have it in practice, in their life, in their everyday situation. I also see it as bang for your buck because it's more sustainable for a lot of families. We get burnt out going from appointment to appointment and things like that. So I think that that's really, really worthwhile to have them come to you. And I just love that it equipped Sol so well.
Yeah,
I think that was wonderful.
Yeah, and I think I want to echo that too. I think for me now, being further along and Dak's been in year 5, I think by doing that and using our therapy supports in his early childcare setting to build the capacity of the people supporting him day in, day out, we've actually transferred that into our model around when he's at school now. So we don't do therapy as such. We use our therapists to build the capacity of us and the people that are with him every day in a place where he loves to be, loves to learn, and is very motivated. So one last question, Vilike, what's one key message you would like families and educators to take away about making therapy work effectively in early childcare?
As I said it before, but we're a team and we want the same for your child, which is them to be happy and to thrive. So we want to work together with you and the educators. Because I'm coming from the preschool where we are on site like all day. So we have the therapy team there all day. But I also realize that other people, like the person who asked the question, the OT might come and go and they're only there for an hour. So they are on your team. Like, remember they're on your team, but maybe look at different ways on how you can, make that work better. Work with them and
collaborate and
collaborate. That's the word.
And sometimes we do need to prioritize one thing over something else for a time being. And it is really about working together. But thank you so much to both of you for sharing your insights and experiences with us today. Love the practical examples and stories that really bring to life what best practice therapy can look like in those settings, and how it can make such a difference for children and us as families. Thank you to everyone that's watched live today, and for that question, Ellen. It was a great question. So this is our second session in our 4-part series. Our next session is going to focus on building strong partnerships with early childcare. I'm sorry, I'm losing my voice and my words. But yes, our next session is going to be on Monday next week. If you have registered, you'll receive an email reminder with connection details closer to the date. I will also share the link to the event in the chat for anyone that wants to register next week to hear about building strong partnerships. I'll also include the link to that event with the resource email. But again, I think today's discussion's just shown how Embedding therapy in early childhood settings can create more inclusive environments where all children can learn, play, and develop together. Thank you so much. I hope you all have a wonderful week, and I look forward to seeing everybody else at our next session where we continue exploring ways to support your children's early education journey. Thank you, guys.
Thank you.
Good to see you both, and I hope to see you all soon. Thank you.
Bye.
Bye.